The United Nations has said some 700 children have died in Somalia nutrition centres as the country teeters on the brink of famine. In Somalia, which lies in the Horn of Africa, almost 8 million people, that's about half the population, are facing crisis hunger levels. More than 200,000 people are already starving. The worst hit area is the Bay region in the south. The UN says, barring a massive influx of assistance, that region is likely to see a full-scale famine in the coming months.
Southern Somalia. This is what the worst drought in decades looks like. People displaced by climate change and conflict. Their only source of water is this distribution center in a displaced persons camp. The United Nations Humanitarian Agency has been sounding the alarm for some time.
I've been shocked to my core these past few days by the level of pain and suffering we see so many Somalis enduring. Famine is at the door, and today we are receiving a final warning.
It's been 4 failed rainy seasons in a row, and now the UN says a 5th one is on the way. But the problems in Somalia run even deeper. Decades of civil conflict, mass displacement, and one of the lowest standards of living in the world.
What's happening in the Horn of Africa is a threat to a way of life which has sustained families and communities for generations. It's not just a lack of rain for 4 seasons. For many families, it's an end to the way they've lived.
A surge in food prices worldwide and a grain shortage triggered by the war in Ukraine have made the situation worse. This entire region is on the brink of extreme hunger, waiting in vain for the drought to end.
We can speak now in more detail with Najwa Meki with the UN Office for the Coordination of Humanitarian Affairs. She joins us from Mogadishu. Ms. Meki, welcome to DW. Thank you for your time today. When we talk about drought and hunger, that's certainly one thing. And when we talk about famine in South Somalia, that's really something else. Who would be the hardest hit?
It's always the most vulnerable. It's always the youngest. It's always those who live in the most inaccessible areas. I'm here in Mogadishu, as you said, and the last couple of days I've been to a couple of hospitals, one in Baidoa, which is literally the epicenter of this latest hunger crisis, and another one in Benadir, almost right here in Mogadishu. And what you see there, it just stays with you forever. Children who are so weak and so malnourished and so skinny and so sick that they can't even smile. I did not see a single child smiling in those 2 hospitals. You can barely hear them cry. They don't even cry, they whimper. They're so weak that all you could hear is a little bit of whimpering in the background. That's how sick they are. And the sad part is, these are the luckiest ones. These are the ones who are able to come and seek treatment in hospitals. The worst off are those who are in areas where they don't have medical care, where they don't have health infrastructure, where their parents don't have the resources to even get them to the hospital so that they can get care. Those are the ones who are always the worst hit.
It's really, really heartbreaking to hear. What is the most needed to try and counter this problem, huge problem, and where does it need to come from? It needs to come, it's a collective responsibility. It needs to come from all of us, and it needs to happen in different stages. First, the most urgent thing now is we need to save lives. We've done this before. We did it in 2017. We should be able to do it again. For that to happen, we need extra support, we need the financial resources, and we need the access. Somalia is not the safest country for aid. So we need to be able to get to where the needs are, to where the most vulnerable women, men, and children are, and provide them with the support they need. That's access. We also need the resources to do that. Longer term, and equally important, is we need to put together systems in place to put the investments in making sure that this doesn't happen again. And the way to do that is to provide the services where people are. They don't need to travel long distances to come to get care. They should be able to seek medical care in their neighborhoods, in their communities. They should be able to access safe water in those same neighborhoods and in those communities. And we need to find a way, as you heard in your report, the whole way of life is under threat. So that's not sustainable anymore, to live by cultivating the land
or by raising livestock. There needs to be other ways for people to sustain their families that are more adaptable to the sad reality that they go through, let's face it, every other bit of time. It's not the first time that we've seen this. It's one of the worst, and we worry that it's only going to get much worse.
Indeed. And on top of the drought, you also have the fact that at least 90% of Somalia's wheat comes from Russia and Ukraine. That's something we've, of course, reported on a lot, that the war in Ukraine has been disastrous for that situation. That must be having a dire effect.
It is having a deep effect, but it's not going to be the only solution to what Somalia is experiencing. It's good. We've seen an increase in the quantities of wheat being exported through the Black Sea corridor. It's increased by 1 million. We're confident, we hope some of that will benefit Somalia. But this is not just about lack of food. We have to be very clear. This is about a combination of factors. If you're malnourished, and you get sick, your chances of survival are even worse. So we need to provide the food, but also we need to prevent the diseases that make it even more dangerous for children in particular, and mothers and pregnant mothers when they get sick. So we need the food, we need the grains, we need the safe water, we need the vaccination, because the kids who are dying from this are those suffering from malnutrition, pneumonia, diarrhea, and a combination of these different factors.
Najwa Meki, thank you very much for your time today. Najwa Meki with the UN Office for the Coordination of Humanitarian Affairs.